Starting a lymphedema prevention program is a lot simpler than you might think. It's as simple as test, trigger, treat. Aside from supporting and advocating for the program, your role is to identify cancer patients who may be at risk. And it's simple because there are three main risk factors: surgery, radiation, and chemotherapy, each of which may damage the lymphatic system. As a surgeon, you're uniquely positioned to identify these patients early, before they begin treatment. Once a patient has been identified, they will be tested by a member of your staff. The L-Dex score, available in ImpediMed's FDA-cleared SOZO device, has been shown to be a reliable test for detecting subclinical lymphedema. All diagnosed patients will be measured for their baseline L-Dex score before their cancer treatment begins. The test itself takes less than 30 seconds and provides an immediate reading. After cancer treatment, it's important to create a plan for succession of care. Current clinical guidelines suggest that patients should be tested every 3 months for the first 3 years, every 6 months for years 4 and 5, and annually thereafter. Evidence shows that if a patient's L-Dex score rises 6.5 or more from the baseline, that's a trigger to evaluate the patient and initiate intervention. That's the process for early detection. But what happens when patients trigger for subclinical lymphedema with an elevated L-Dex score? Clinicians have many treatment options available to them, but research has found wearing a compression garment for 4 weeks prevents disease progression and has been shown to bring the incidence of chronic lymphedema down to under 3% in breast cancer patients. After a successful intervention, patients will still need to be tested, but won't need to continue wearing compression garments unless their L-Dex score rises above normal levels again. Implementing a lymphedema prevention program in your practice is simple. The extra effort is minimal, but the impact on patients is significant. As your patient's best advocate, you are the best hope for early detection. You are your patient's best hope for prevention. It's time to take LE seriously. It's time to take the lead.